You want to
He calls Reide Quanton to the stand.
Okay.
And Judge, just for purposes of the media in the courtroom, this is testimony regarding the autopsy. There's going to be photographs. So I'd ask that they be reminded not to show anything that's displayed in open court.
All right, please don't show these photographs.
Do you solemnly swear the testimony you give in this matter shall be the truth, the whole truth, and nothing but the truth?
I do. Good afternoon.
Good afternoon.
Can you please state and spell your name for the court record?
Yes, my name is Dr. Reide Quanton. The first name is Reade, and the last name is Quinton.
Are you employed?
I am a physician currently employed at the Mayo Clinic in Rochester, Minnesota. I'm also a forensic pathologist serving at the Southern Minnesota Regional Medical Examiner's Office.
Can you tell us a little bit about what you do as a physician and how you became a physician?
Sure. So my background, I went to med school at LSU Med Center in New Orleans, Louisiana, which is where I grew up. After med school, I went to Dallas, Texas to do a 5-year residency training program in a combined anatomic and clinical pathology residency program. After residency, I stayed in Dallas and did a 1-year subspecialty year, which we call a fellowship, which is in forensic pathology specifically, and that was at the Dallas County Medical Examiner's Office. So after all of that training, I'm board certified in anatomic pathology, clinical pathology, and forensic pathology. Currently licensed still to practice medicine both here in, not here, but in Minnesota and in Texas still.
Can you tell us a little bit about the different areas that you talked about with pathology? You said anatomic pathology, and what were the other two? I'm sorry.
That's okay. Clinical pathology and forensic pathology.
What are the difference between the three?
Sure. So anatomic and clinical are the two big divisions between the practice of pathology, and pathology is basically just, in general, the study of disease. We kind of think of pathologists in terms of those are the doctors who operate behind the scenes, who run the laboratories, look at specimens, and kind of direct the using what our results are to help direct the clinicians who are actually treating patients on where to go next in their treatment. So in anatomic pathology, that's everything that has to do with specimens that come from the body that are tissue-based. So for instance, everything from pap smears in cytology to autopsies, which would be a full dissection, but also a lot of what anatomic pathology is really just dealing with surgical specimens, so either biopsies or big surgical procedures, and those specimens go to the pathology lab later. So for instance, if they resect a tumor, the pathologist is then the one who says, yes, this has been fully resected, the margins are clear, those types of things. So that's anatomic. Forensic pathology is a subset within anatomic, so it's under the anatomic umbrella where we specifically do autopsies and specifically deal with medical legal death investigation. So that's still all anatomic. Clinical pathology is the other half. And that essentially is, if you think of it in terms of every other laboratory in the hospital besides the autopsy suite and the surgical suite. So the blood bank, so anytime you need blood products, those are run by pathologists. The microbiology lab, the molecular genetics labs, all of those laboratory practices all fall under pathology. So combined, many of us do sort of a combined training in anatomic and clinical pathology and then subspecialized after that.
What does it mean to become board certified in those areas? Because you're board certified, as you told us, in all three. Is that correct?
Correct. So board certification is the final exam that you take once you complete all the training in those areas. So this is, again, after medical school, after residency training, you do this final set of board exams to establish that you are a practicing anatomic pathologist or clinical pathologist, or in my case, also forensic pathologist.
And After becoming board certified in those areas, I imagine you began performing autopsies, is that correct?
That's correct.
Can you give the jury an idea of how many autopsies you performed in your career?
Sure. It's quite a bit. I can't give you an exact number, but in residency, especially knowing that I was interested in this field, I did probably over 140 autopsies just during my residency training. Probably another close to 400 when I was in my 1 year of fellowship, and then after that, subsequently, probably the first 5 to 7 years in practice, I was doing about 400 cases a year. Currently, I still do about 200 to 250, anywhere around there per year. So the answer is I've done thousands.
Thousands.
Yes.
What's a curriculum vitae?
Excuse me?
What's a curriculum vitae?
Curriculum vitae is sort of the terminology that we use for the resume. It's an academic resume, basically.
Okay. Would you recognize a copy of your curriculum vitae if you're received in court today?
Yes.
I'm handing what's been marked as state exhibit number 26. I'd ask you to review that. Let me know when you're done.
Okay. Okay.
Do you recognize state's exhibit number 26?
Yes, this is a relatively current copy of my CV, my curriculum vitae.
At least as current as the last date on the document?
Correct.
Okay. I'd move state's exhibit number 26 into evidence.
No objection. Please.
Dr. Quanton, above and beyond performing autopsies, do you hold any national positions relative to your practice in forensic pathology?
I'm currently the chair of the board for the National Association of Medical Examiners. We go through, or those who choose to try, we go through an officer process in the National Association of Medical Examiners. So it's a 3-year run, basically going from vice president to president and then chair of the board. So I served as president last year, and now I'm on my way out as chair of the board.
What's the name of that organization?
The National Association of Medical Examiners.
NAML?
It's
NAME?
AIM.
Yeah, name. I'm sorry, I got that wrong. And what's the responsibility of that professional organization?
So we are the organization that represents forensic pathologists across the country. We certainly have membership from other categories, not just forensic pathologists, but also death investigators and a lot of trainees as well.
I want to talk to you now about the practice of forensic pathology, in specific, the autopsy of Alexavier Pedrin. Did you perform an autopsy on the body of Alexavier Pedrin?
Yes, I did.
What are the different components of performing an autopsy?
Sure. The autopsy consists of a number of parts. The first part happens before it even really starts in the morgue, which is just the accessioning and acceptance of a body. So when it's received to the morgue, there's death investigation and investigation stuff at the scene that happens before that. I'm not really going to count that. But as it is received to our facility, the first thing that happens is the decedent is given a unique identifying case number, and then that follows throughout the entire course of the case. The second part of that would be the external examination. So that is going through everything related to the body and reviewing it externally. And that includes everything from what is the individual wearing at the time that they are seen in the morgue, what types of identifying features do they have, marks, scars, tattoos, hair color, eye color, things like that. And then eventually assessing the entire body for evidence of either natural disease processes or injuries. After all of that is done, then the next part of that is what most people think of as the autopsy, which is the internal examination. And so that is where we open the body cavities and remove the organs. We're looking at the brain, we're looking at the chest organs, so the heart, lungs, and then the abdominal cavity as well, so everything in that area. Another component of this, while all of this is going on, is we collect a lot of samples that can be studied for toxicology. So we collect blood, we collect vitreous fluid from the eyes, a number of samples that are then used subsequently in the next part of the report to look for evidence of drugs, alcohol, things like that. And then after all of that is done, then the final part of the, quote, autopsy itself is the autopsy report, where we generate a final autopsy report that kind of collates everything together. And that oftentimes includes other specialty examinations that happen sort of tangentially at the same time. So for instance, if we send the brain to neuropath conference for analysis, in some cases we send other organs as well. And so the final part would be generation of that completed autopsy report.
Was a completed autopsy report done for Alexavier Pedrin?
Yes, it was.
And was that done by you?
Yes.
Would you recognize that document if you were to see it in court today?
Yes.
Hey, before we can begin, can you just come on up for a second?
Sure.
Go ahead.
Permission to approach?
Yeah, go right ahead.
I'm handing you a spin marked as State Exhibit number 27. Can you review that and let me know when you're done?
Okay.
Is State Exhibit 27 a copy of your autopsy protocol report for Alexavier Pedrin?
Yes, it is.
Okay, I'd move 27 in evidence.
No objection. Okay, received.
Before we start diving into the specifics of the autopsy for Alexavier Pedrin, I want to talk about the classifications that you can make for the manner of death. There are, as I understand it, 5 different classifications. Is that correct?
That's correct.
What are those 5 different classifications? Can you explain those to the jury, please?
Sure. So when we look at a death certificate, medical examiners have to look at filling out cause of death and manner of death. And the manner of death is a medical opinion that's composed of 5 options. So those are basically natural, so natural disease, accident, homicide, suicide, or in some cases undetermined.
And those are the 5 options that you have when you reach manner of death. Is that fair?
Correct.
Okay. Cause of death can be many things. Is that also fair?
Yes.
One of the options that you mentioned was homicide as a manner of death, correct?
Yes.
And I just want to give an example. A manner of death can be ruled homicide. Homicide in your world means death at the hands of another person, correct?
It's either due to the actions or inactions of another person, yes.
Actions or inactions of another person. So for example, if someone were frustrated with me and I tried attacking them and they shot me in self-defense, them shooting me in self-defense could be ruled a homicide, but it may be legally justified if it was actually self-defense, correct?
That's correct.
Okay. So you can have different outcomes from your determination from a medical perspective and a legal perspective.
Absolutely, and we have the opposite occur quite frequently in motor vehicle accidents. So by definition, most of those, unless there's intent that we have, those are called accidents. So if someone strikes another vehicle, but those can be prosecuted as vehicular homicide or whatever. So there's a distinction between the medical terminology and the legal terminology.
For example, if I were driving drunk and I caused an accident by my drunk driving and the passenger in my car died, I could be legally responsible, but it would be declared by a medical examiner an accident.
That's correct.
Okay. I want to talk now about the specifics of performing the autopsy for Alexavier Pedrin. What was the date that this autopsy was performed on?
The autopsy date was February 13th.
February 13th?
Of 2023.
This is 2 days after the death of Alexavier Pedrin.
Correct.
Okay. When you are conducting the autopsy, do you get background information about the circumstances of the death?
Yes, I do.
Did you have that in this case?
Yes.
What was the background information that you had prior to performing the autopsy?
So prior to performing the autopsy, we usually get sort of a compiled narrative that is from one of our local death investigators who speaks to the family, speaks to law enforcement, kind of gets the information they need to give us an idea of what the case is about. It's certainly not all-encompassing or all-inclusive, and other information may show up as we go. But in general, we knew at the very beginning of the case that the child was found unresponsive at home, and that there were some pill containers near the body, and that was the main thing, and that basically he was dead on scene and not transported to the hospital.
Okay, so he was found unresponsive at home. There was a pill container or more found on scene, and he was declared deceased on scene.
Correct.
Okay. That was the basic information that you had.
Yes.
I want to talk now about the examination of Alexavier's body from the outside perspective. What is the first thing that you took note of when you were examining Alexavier Pedrin's body as a whole from the outside?
I think some of the things that stand out at the very beginning, just doing the cursory beginning of the external examination, is number one, that he had a cast on his right leg. And we didn't have at that time too much information about that, but there was a hard cast. And then also, as we removed the clothing, just in general, he had sort of a look of, I won't say malnourishment, but just dehydration. So you could see the ribs pretty prominently. The eyes were kind of sunken. And then there were a lot of bruises and other injuries that we'll describe later. But overall, that was what we saw.
With regards to the dehydration, the sunken eyes, and the pronouncement of the rib cage, what, if anything, did that tell you from a medical perspective? He didn't seem to have enough fluids at the time. Now, that could be that he wasn't receiving them or that he was sick. You know, it's hard to say in a vacuum without knowing anything else. But he certainly didn't seem well hydrated. If this was a child that was reported to have COVID relatively recently, that could be one potential cause for that presentation or a contributing factor.
Could, if the COVID was causing him to have vomiting spells or something like that, then maybe. But if they're still eating and drinking properly, then probably not. So.
Then you wouldn't expect to see that type of pronouncement with the ribs or the sunken eyes?
Not necessarily. You'd have to have some reason. Either they're not taking in enough fluids and food, or they're vomiting, having diarrhea, something like that. So it could be related to COVID, depending on how you react to COVID.
I want to talk now about your examination and documentation of the injuries on the outside of Alexavier's body. Did the number of bruises on Alexavier's body stand out to you?
Yes.
Did the location of those bruises stand out to you?
Yes.
Did the frequency of the bruises in different locations stand out to you?
Yes.
Okay. You would recognize photographs from the autopsy if you were to see them in open court today?
Yes, I would.
Okay, I'm going to show you what's been marked as States Exhibits 29 through 56. Your Honor, the record should reflect that States Exhibit 57 is also a PowerPoint that contains these very same photographs. Doctor, I'd ask you to review 29 through 56 and let me know.
Okay.
Do States Exhibits 29 through 56 fairly and accurately capture the outside physical condition of Alexavier Pedrin's body on February 13th of 2023 when you performed the autopsy?
Yes.
I'd move 29 through 56 into evidence.
No objection.
Received?
Permission to publish.
Objection.
I'd ask that I'll need control for the PowerPoint for 57, please. Oh, PowerPoint is 28. I'm sorry. That's my fault. Dr. Quinton, can you see the screen?
Yes, I can.
Okay. You see the first photograph that's being displayed for the jury?
Yes.
Okay, is that the first photograph that you have in your stack?
Yes, it is.
Okay. Can you describe to the jury what we see in this particular photograph? You have the number, so if you could help me, give me what number this is.
Sure. This is exhibit number 29. This represents what we would consider our identification photo at the time of autopsy. So on every case, we always do an identifying shot that just shows the features of the face from directly on.
In this photograph, explain to the jury the injuries that we can observe on Alexavier's face.
So there are a number of bruises and a healing, excuse me, a healing laceration on the right eyebrow. So kind of going from top down, I don't have a pointer, but still, right in the middle of the forehead near the hairline is one bruise. You see a cluster of bruises around the right eye. So basically very lateral on the eyebrow is a healing laceration or basically tear of the skin with a contusion around that. Contusions are just bruises. And then the upper and lower eyelids, basically you see those area on the right eyelids, those areas of red, those are both bruises on the upper and lower eyelid. There's two bruises on the right side of the chin as well, one a little bit more linear down at the bottom and one that's a little more circular, a little higher than that. Just in general, too, you can also make out that those eyes, the orbits seem to be kind of sunken as well, which we talked about earlier.
Can you make out in this photograph any injuries to Alexavier's neck?
There's two on the left side of the neck right along the edge of the mandible. You can barely see them in this photo. There's also a little tiny abrasion, little line on the right side of the neck. But really, the ones that I documented were on the left side of the neck, right under the mandible. And
you talked to us about a case number when the body is received. Is that what we see on the ruler in the bottom of this photograph?
Yes, it is. So we will try to make sure that that number, that case number, is on every photo that we take.
All right. If we can move on to the next photograph. Doctor, again, I'm going to ask your indulgence in helping me with what number this is in the photographs in front of you.
Sure. So this is exhibit number 30, showing some of the same injuries that we saw in the last image, but this is on the right side of the face, so a lateral shot. You see the two bruises of the chin that I described earlier. Similarly, that mark on the lateral, so outside portion of the right eyebrow, which was that healing laceration we talked about earlier. A little bit of the bruising of the upper and lower eyelids, but also there's a sort of a little vertical linear abrasion on the side of the face here, which in the report would be described as sort of the zygomatic region of the face. And I think that's most of what is shown in this image.
When we're talking about bruising, doctor, it's fair to say that bruises cannot be dated with any medical precision. Is that correct?
That's correct. There used to be old textbooks and things like that that would make an attempt to do it, but honestly, we're very, very cautious. The only things we'll ever say, we'll describe them, so we'll say if they're red or purple, those tend to be kind of quote-unquote fresh, but we're never going to say it's an hour, 2 hours, things like that.
Okay. Fair to say that we expect bruising to show up within hours of an assault, though. Would that be fair?
That is fair. In most cases, yes.
Okay. In this photograph of the right side of Alexavier's face, can we also start to see bruising in his hairline?
Yes, you can. So I mentioned earlier that there's one in the middle of the forehead. We're now looking a little bit on the right side of the forehead, and you can make out the beginnings of one bruise there.
When we're examining bruises on someone's body and we're examining whether they could be from accidental means or inflicted means, is it important to look at the number of the bruises?
Absolutely.
Why is that?
Well, so any one circumstance of blunt force trauma, so just a bruise or a scrape or something like that, could be from any number of things, and you could come up with many explanations. So if you're looking at each one individually, unless they are distinctly patterned, you can't really say what they're from necessarily. So then we also rely on the sort of distribution, where they're located, and then also the number. So in kids or adults, for that matter, when people fall, hit their head, they tend to hit areas that are sort of bony prominences and things that stick out. So especially in kids, you're going to typically see things, they're going to have bruises on their elbows, bruise on their knees, things like that are kind of accepted to be sort of classically accidental, although, again, they could be inflicted. But when we look at the totality of the number of injuries, that's where we start to sort of accumulate data to decide at what point is this too much to be what we would accept as just accidental.
When we talk about children and bruising on children, are you familiar with the term of protected areas and not protected areas?
Yes.
What does that refer to?
So basically, it kind of goes back to what I was talking about earlier with bony prominences. So there are some things that just stick out that are naturally the places that people will hit, and then there's other areas that are much more protected. So for instance, inner thighs, gluteal folds, folds that normally you would have to have some access to get to damage.
And we talked about it a little bit earlier, but looking at this photograph, can you help us understand when you have bruising on different planes, what does that mean? Different planes of the body, different planes of the face?
Right, so the locations here are sort of multiple. You know, we've got forehead, eyebrow, eyelids, which is unusual. That would be more of a protected space. Chin, again, each and every one of these, except for maybe the eyelids, would be something that you might typically see in another scenario, like somebody fell and hit their head. But all of these in constellation are a lot of different injuries. So you would have to have a reason to have that many different injuries.
When we look at this photo of Alexavier, we can say that there's been multiple blows. Is that fair?
That's fair. There's at least 5 or 6 points of impact just in this one image.
Okay. If we can move to the next photograph, which is the left side of the face. Nope, I apologize. It's a close-up of the right eye.
Correct. And this close-up, which is Exhibit 31, shows the upper and lower eyelid. Again, that red discoloration is bruising. That edge of the eyebrow where we've got the healing laceration, and a little bit of the bruising in the hairline as well, plus that small abrasion on the outside of the face.
Dr. Quinn, I place in front of you a laser pointer, if that is helpful to you at any point. I believe it's the circle button in the middle.
Got it.
All right, if we can move on to the next photograph, please. What do we see? This is 32?
This is Exhibit 32. Not nearly as many injuries on this side of the face, although we do see the 2 little linear abrasions that were underneath the mandible, so the angle of the chin there, or not chin, but jaw, that are extending onto the neck.
And again, this would be a completely opposite side of the head, a different plane altogether than what we looked at in 30 and 31.
Correct.
Okay. Say Exhibit 33.
So Exhibit 33, unfortunately on cases like this, we oftentimes have to shave the scalp so that we can actually see beyond the hair to assess the injuries. So in this case, we're actually looking at the top of the head straight down. So the top where the case number is would actually be the forehead, and then the bottom of the screen where the hair still is intact would be the back of the head. And so we're looking at several more contusions on the top and the side of the scalp, basically a large kind of 6 centimeter red contusion or bruise that's on the right frontal scalp, just slightly to the right of midline, and then also a separate bruise on the what we would call the right parietal scalp with a little abrasion over it.
Again, different planes than the other photographs that we looked at previously.
Correct.
Okay. Takes Exhibit 34. What do we see in this photograph?
Okay, so 34 is the scalp a little bit more shaved and on the side. So we're again looking at the right side of the scalp and face again. You can still make out that healing laceration that's over the eyebrow, but now you can see a little bit better the different areas of bruising. There are a few of these darker dots or little abrasions or scrapes, but then the red areas are all what we would call, again, contusions.
One of the dark spots that you pointed to, I took to be a mole or a birthmark. That's not a mole or a birthmark?
If you're talking about this one right above the ear, that's another abrasion.
That's an abrasion?
Yes.
Okay, and it's in a circular pattern?
Yes.
Okay. Is there any bruising also in the ear?
I don't recall there being any in the ear. There is a little bit of red discoloration, but I think that's mostly lividity.
Okay. What's the difference between lividity and a bruise? First, can you explain what lividity is to the jury?
Sure. So when someone dies, their circulation stops, so their heart stops beating. When that happens, all the blood in your body just pools towards gravity. So you will see a patchy red discoloration on the parts of the body that are dependent towards gravity. So in many cases, if the body is laying face up, then everything will pool towards the back. And so you'll see this kind of dark red or patchy red discoloration. So that's what we mean by lividity.
In a little bit, we're going to see pictures of Alexavier's back. You as a medical professional have training on how to differentiate bruising from lividity?
Yes, and sometimes it can be difficult, which is why we will look under the skin as well. And particularly in his case, in the back, there are some areas that look a little concerning for a bruise, but then underneath, it's really not. It's just that pooled blood.
Okay. We'll talk about that a little bit more when we get to those photographs. I think we were on 33?
So this one is 34.
34. So if we can move on to States Exhibit 35. Now this is 35, 36, and 37 in
Correct.
sequential order. Is that correct?
That is correct. So yeah, these are basically kind of rotating around the back of the head, and again, having to shave hair. Most of these areas that you see that are the red discoloration are more areas of bruising. A lot of that is confirmed when we reflect the scalp, so when we actually make an incision in the scalp to get to the skull later, we will see bruising underneath the scalp to kind of confirm that these are bruises and not just lividity. But yeah, so you can see kind of the patchy red discoloration. And there's
Those would be additional planes, additional blows?
Correct.
Okay. Can we move on to the next slide, please?
Okay.
38.
This is 38. So anterior neck image and under the chin. Basically, there was a linear bruise under the chin here. The two linear abrasions that we noted earlier along the jawline, and then it's not in the report, but that little tiny scrape there too.
Were there any injuries inside of Alexavier's mouth that you noted?
No, there were none in the mouth. So we do look at the gums, the inner mucosa of the mouth, because if someone is struck in the face, they might tear their inner lips up against their teeth. There's nothing like that. We also did what we call an anterior neck dissection, which is looking layer by layer by layer through each layer of the musculature of the neck, just to look for any additional bruising that might be related to something like strangulation, which there was none in this case.
You didn't find any of that bruising inside the layers of the neck?
No.
Okay. You can, to be fair, Dr. Quanton, you can strangle someone and not have those bruises appear. Is that true?
That is true, yes.
Okay. And you can cut off oxygen to a child by means other than choking them through the neck. Is that also true?
That is true.
Okay. We can move on to the next image. These are, can you help me orient with the numbers on these, please, Doctor?
Yes, so these would be exhibits 39, 40, and 41.
Okay, I'll start with 39. What do we see in States 39?
So all of these images are showing us the anterior chest and abdomen, but 39, the first one on the left-hand side of the screen, is just representing the right side of the chest. There were a cluster of bruises that we could see on the chest wall here. There were about 3 or 4 that you can make out in this image, maybe another one down there. You can also note in both of these just the prominence of the ribs as well.
And in the last photograph, can we notice the prominence of even the arms and the sunken eyes?
Yes. I will note, though, in your images here, this one's reversed. I'm not sure how that happened in PowerPoint, but this image is actually reversed. So if you notice, the number is backwards, and all of these bruises should be on the right side.
Oh, I do see that. Okay.
So the only other thing I was going to note is the mild green discoloration on the abdomen. That is not an injury. That is another postmortem artifact. So there was a little bit of a delay between the time that he died and the time that we did the autopsy, and in that time we are seeing some postmortem changes. So that faint green discoloration is just early decompositional change.
So that's a natural
That's a natural
process.
phenomenon. Yes.
Okay. What can you tell us about the frequency of bruises that we see in these 3 images?
So again, they're kind of clustered. There's at least, like we said, up on the chest here, a cluster of about at least 4 of them here. There's one over what we call the xiphoid process in the middle of the chest. There's also one that I think we have another image of that's over the left shoulder as well. So multiple points of impact, different locations.
And The record should reflect, Your Honor, that the very last image, Doctor, what number is the very last image?
The last image is 41.
41 does have a black box over the genitalia of Alexavier. The images that are being admitted into evidence do not have that, but I was taking caution in using these in open court. All right, if we can move on to the next image.
Okay. The next images are all of the right upper extremity, so the right arm. These are 42, 43, and 44. We have in the image to the left of the screen, basically the arm is raised, and we're looking at two areas of bruising on the inner right arm and the inner right forearm, basically two of them in parallel on the forearm, and then one larger one on the arm. The small round bruise, this is on the opposite side of the forearm, the right forearm, that's in the middle image. And then image number 44, which is on the right side of the screen, is basically just a close-up of the bruising that we see on this arm.
When we were talking about protected areas before, this is on the inside of Alexavier's arm, what we see in the first and third image on the PowerPoint on this slide. Is that correct?
So I think of extremities as sort of a mixed bag. Obviously, if you fall, you're going to land on the outer surfaces, but that doesn't mean that you can't do something accidental to injure the inner surfaces. So mechanistically, I'm not sure if I would include some of these as some of those protected areas, but certainly more protected than the outside, the outer surfaces.
And upper arm, even more so from a fall, depending?
It just depends.
It all depends. Okay. Next slide, please.
Okay.
What numbers are these, Doctor?
These are numbers 45, 46, and 47. The number 45 on the left-hand side of the screen is sort of a combined abrasion and contusion it's kind of on the upper left side of the back right side of the back near the left arm, if I'm looking at that one correctly. This middle image is looking down at the left shoulder. So the body is going downward from here. The knee is down at the bottom of the screen. So that's just a bruise over the left shoulder. And then the image on the right-hand side of the screen, which would be Exhibit 47, is another bruise on the left forearm.
Again, multiple different areas of the arm, correct?
Correct.
Including the top of the shoulder?
Correct.
All right, if we can move on to the next slides, please. What do we see in these three images?
Okay, so these are all images of the back. This would be Exhibits 48, 49, and 50. Again, this one's a little bit more complex because there's multiple things we're looking at. Some of this is bruising, but a lot of this patchy red discoloration is that lividity I talked about earlier. So especially as we move up the back on the left-hand image, which is sort of the far away image, you can see there's an area of distinct bruising over the buttock region, right near the cleft in the middle. But then this area sort of just above that looked to be another bruise. It really turned out just to be more lividity. Some of this is patchy. This is all patchy lividity above the waistline as well. But then this other sort of circular or two circular lesions here on the right side of the back, which is close up in the middle image, that is a bruise, but it's more of a brownish bruise instead of red. So this would be maybe something a little bit in later stages of healing. We haven't really talked too much about the different colors of the injuries, but if they're brown, they tend to have been around a little bit longer. You also can make out in several of these images that there are some scars. So there's a scar of the lower right side of the back and a little linear scar right above the buttock. Can't make out what those are from. A little bit unusual location because, again, a little bit more protected than some other areas that you would expect to see scarring on.
All right, next image, please. What numbers are these three images, Doctor?
So these are all the left leg. We're looking at Exhibits 51, 52, and 53. So going from top down, if you look at the left-hand side of the screen, this is the left thigh and the left knee, and then these are just images that kind of focus in on the different areas. But the left thigh has a large cluster of bruises sort of on the anterior, so front of the left leg, but also, or left thigh, but also on the inner part of the left thigh, because this is rotated sort of to show the inner surface. We also see some scrapes on the left knee as well, some circular abrasions on the left knee, and then 2 linear abrasions on the medial aspect of the left knee, so the inside of the left knee as well. The other 2 images basically just highlight those injuries.
When you're examining the circular abrasions to the knee, does that give you any pause or concern for inflicted injury?
It's really hard to say. The ones on the knee itself could just be falling and scraping your knee. So it may be of all things, it doesn't look patterned. Of all things, that might be one of the few injuries that I'd expect to see on a kid who's 6 years old.
From a fall?
Yeah.
Okay. But the other bruising that you described on the upper portion of the thigh, it's a little bit on the inside of the thigh, is that correct?
Correct.
Okay, that's obviously more concerning.
That's much more concerning, yes.
Okay. Next image, please. What number is this, and what do we see here?
This is exhibit number 54. This was a bruise. So basically, we're looking at the left side of the body. The buttock is on the top of the screen. The left leg is right below that. So it's one prominent red bruise sort of on the lateral aspect of the left buttock.
Okay. Next
Or,
image,
excuse
please.
me, I'm sorry, I keep saying left. That's right.
That's right.
My apologies.
Next image, please. And this is a picture of the thorax from the right side?
This is a picture of the thorax from the right side, exhibit number 55. Again, the prominence of the ribs is noted here, but there's a cluster of 2 bruises on the lateral side of the body.
Some bruising might be expected when CPR is performed, is that correct?
Yes, but this would be a very strange location for that.
Okay, that's what I was going to say. This is not where CPR would be expected to be performed, correct?
That's correct.
Okay. And they've already had the benefit of seeing the CPR in this case. We'll move on to the next image, please.
Okay, and this is image or exhibit number 56. This is of the left hand, and very specifically 2 areas of bruising. This area right at the base, sort of at the base between the left thumb and the left index finger. Part of this extends onto what we call the thenar eminence of the left hand. And then another bruise that's sort of on the back of the left hand as well, what we would call the dorsum of the left hand.
Is that the last image?
That is the last image I have up here.
Okay. When you are looking at the number, nature, and frequency of the bruises on the outside of Alexavier Pedrin's body, tell us what your impression is of all those injuries before you even start the internal examination.
Well, the constellation of all the findings externally was too many injuries to account for just an accidental fall or something like that. So this looked as a constellation of finding like inflicted trauma.
When you're practicing medicine, is it important to look at the patient or in this case, the body that's in front of you and examine the totality of the circumstances?
Absolutely.
Okay, you would never look at and examine one finding in a vacuum, is that fair?
Correct.
That's not the practice of medicine.
No.
So the number, nature, and frequency of the bruises that you observed just on the outside of the body would be consistent with multiple blunt force injuries inflicted by another person?
Yes.
Okay. Let's talk about your internal examination of Alexavier Pedrin now. What did you find when you performed the internal autopsy?
Sure. So it depends on where you're looking, but the internal examination, if we just start from the head and work our way down, basically reflection of the scalp, as I said before, kind of confirmed the multiple bruises and impact sites that we saw externally. But then once we opened the skull, there was no evidence of a skull fracture or anything like that, but there was evidence of prominent swelling of the brain itself, but no bleeding internally or anything like that. Moving down the body into the trunk, or do you want me to?
Can I stop real
Please.
quick and talk about the swelling of
Yes.
the swelling of the brain? What is the name for that?
So basically, cerebral edema is what that is. It's basically just fluid accumulation that expands the brain itself. The brain, when it swells, that is pretty much the only reaction that the brain has to anything. So any kind of insult to the brain potentially is going to make it swell, or there'll be cerebral edema.
Is that referred to as hypoxic ischemic injury?
So hypoxic ischemic injury is sort of the end description pathologically, but yeah, when we first start out, we just look at it and call it swelling. It's just cerebral edema. But then microscopically, we can confirm that there's hypoxic ischemic injury, looking at is there damage to the cells, things like that.
Okay. Many things can cause brain swelling. Is that fair?
Yes.
Trauma to the brain
Yes.
from a blow to the head,
Yes.
a lack of oxygen to the brain,
Yes.
a slowing down of our system that delivers oxygen to the brain.
Yes.
Okay, all of those things can result in that same brain swelling that we see.
Yes.
Is there any way for you to medically determine if one or multiple causes led to the swelling of Alexavier's brain?
In this particular case, no.
Okay, so it could be one of those things, it could be a combination of all of those things together.
Yes.
And in this case, we already know there's been multiple blows to the body, correct?
Correct.
Including to the head.
Yes.
Okay. When we experience a concussion, when we refer to a concussion, what is that that's happened to our body?
So a concussion is very similar. So you have a blow or sharp movement of the head that kind of stretches, if you will, the neurofibers within the brain itself, but it doesn't break anything. So a concussion usually, given time, will resolve itself and the brain will go back and kind of go back to normal, quote unquote. That's very different from if we had blunt trauma that actually sheared some of those neurons, which would then not necessarily be able to heal because neurons don't heal like that. So it's a little bit of a difference, but concussion is sort of a transient injury.
When I think of, as a layman of concussions, it makes me think of the NFL and how the National Football League examines concussions. They look for symptoms by talking to a person and examining them from the outside. Is that fair?
That's fair.
Is that one of the first ways that one can look at or try and assess if someone has suffered blunt force trauma and may be suffering a concussion?
Yes.
Okay. We were going to move down from the head downward in Alexavier's body. What's the next injury that you detected in Alexavier's body?
Sure. So doing the examination of the torso, basically chest and abdominal cavities, there weren't many injuries of the upper torso. So basically heart was fine, lungs were fine. Once we move beyond that, the next sort of layer is the diaphragm that actually separates both the upper and lower cavities. And there was some bruising on the right hemidiaphragm, so the right half of the diaphragm. Below that, within the abdomen, the first thing we noticed on opening the abdomen was that there was free blood in the abdominal cavity, so what we would call the peritoneal cavity. We collected it. We were able to collect about 100 milliliters of free blood in there. That's not a ton of blood, but I mean, it's a substantial amount. And then after we kind of got past that, there was both what we would call a subcapsular hemorrhage of the liver itself. So basically the liver has a capsule, and a subcapsular hemorrhage would be kind of like a bruise under the capsule, but it's sort of retained in that capsule so it doesn't go out into the abdomen. There was also a laceration or tear of the liver itself. There was also a lot of hemorrhage around the duodenum, which is the very first part of the small intestine, and the head of the pancreas. And all of these things, for the most part, sit sort of within the midline of the abdomen. Let's see. I've already described the liver laceration and the free blood. Oh, and then examination of the abdominal, or the chest wall, I should say. I said there were no injuries of the lungs or the heart, but once we were able to visualize the ribs, there was evidence of one recent fracture of the left 10th rib posteriorly, so basically along the back.
Posterior is the back, left side back, 10th rib.
Correct.
Okay. And you said that that's a recent fracture based on your examination. When I think of talking about rib fractures, I think of talking about them as acute and subacute in a live child. Do you use those same terminologies?
We'll use acute, subacute, organizing, or remote.
Okay. When we talk about an acute fracture in a child, whether alive or deceased, really all you can do is date it within a certain number of days, correct?
Correct.
Okay, so you can't date a rib fracture to hours.
No.
Okay. It could have happened any time prior to that child being deceased.
Well, depending on what it looks like, so if it's a very acute fracture, which basically means there is a break in the rib with hemorrhage, but no evidence of healing whatsoever, that's a shorter time frame. So you can't look at that and say, oh, that happened 3 weeks ago, because it would have evidence of healing. But we can look at this and say it's fairly recent, meaning, probably within the last 24 to 48 hours, but that would, still, it's a very wide range.
Rib fractures are painful.
Yes.
They hurt when you breathe.
Yes.
In some cases of children and adult, you maybe see a rib fracture in the front of a child related to CPR. Is that correct?
Less commonly in children, only because their ribs are soft and pliable, so there's a lot more cartilage depending on how young they are. But sometimes you still can see rib fractures in CPR, even in children. But when you do see them in adults or children related to CPR, they tend to be what we would say is sort of either anterior or anterolateral, so they kind of are right along these lines.
They're not posterior rib fractures.
Typically, no.
And this is it a higher up or lower fracture in the back, the 10th rib?
It's low in the thoracic cavity. It's kind of mid-back if you were looking at the back.
The liver laceration that Alexavier had, that was approximately 3 centimeters, is that correct?
Correct.
Is that a serious injury?
Yes.
Were the internal injuries to Alexavier's abdomen life-threatening injuries for him?
Not immediately, but they could have been. So, meaning if that liver laceration went unattended, it might heal on its own over time, or it might get progressively worse and continue to bleed. Similarly, injuries to the duodenum, so the small intestine, or the pancreas, both of those could become worse over time. So as they react, as they start to try to heal, they oftentimes are in a very vulnerable state and can potentially get worse before they get better.
In your experience, would these have been painful injuries?
Yes.
Would the pain have gotten worse over time?
Yes, most likely.
Would the individual who is suffering from these injuries not want to move as that pain progressed?
It's very difficult to say for any given individual, and when you say not want to move, that's a pretty broad stroke. So I would say they would be less active potentially than normal, but I wouldn't be able to say if they would just be laying in bed and not want to move versus maybe not as active as classic.
That pain would become more pronounced over time?
I would imagine so, yes.
Would you expect the symptoms to be obvious to a caretaker?
Yes.
What is the mechanism for the injuries to the internal organs, the duodenum, the lacerated liver? What type of force is necessary to cause those injuries?
So all of these are from, you've heard us use the term already, blunt force trauma. Blunt force is just basically an object striking an object. It's not a gunshot wound. It's not related to a blade. It's just a crushing blow or a scraping type blow. So that being said, the mechanism in this case is classically, basically, if you receive a blow to the abdomen or the upper abdomen, lower chest, whichever, anything in between the object, be it a hand, be it a foot, whatever, and the underlying spinal column, which is rigid, anything in between those two things could potentially get injured. So all of these things that we're seeing sit right in the midline. So the liver laceration, the injuries to the duodenum, the injuries to the pancreatic head, every one of these is in line in the center between the abdominal wall outside and the spine on the inside.
Can the injuries that we see in Alexavier's abdomen result from one penetrating blow to his abdomen, more penetrating blows, or can you not differentiate based on what you see medically?
So first, I just want to caution the use of the word penetration, because that to us that means actually going through the skin.
Oh,
so
I'm using the word different. I mean it differently than you do. So thank you for clarifying.
Sure. It could be just from one blow. It could be from several blows. It's anything that would be striking the midline.
You mentioned that these were life-threatening injuries for Alexavier. Can you explain that process a little bit, how these would be life-threatening?
So there's several things that could cause this to become much worse. Number one, bleeding. The liver is very, very vascular. It likes to bleed. So again, unchecked, could this heal on its own? Maybe, but it could also bleed and get worse. In addition, the injuries to the small intestine and the pancreas, over time, particularly the pancreas, as the pancreas becomes inflamed, you can start to see a lot of very crucial problems with that. The patients oftentimes may go into shock or multi-organ failure depending on how badly that progresses. The duodenum might heal on its own again, but also very potentially could perforate if the wall is weakened as it's trying to heal. And so then you run into a situation where maybe a couple of days after the event, now the person becomes acutely much more ill, and it's because the contents of whatever they're trying to eat are now spilling out into the abdomen because of the damage to the duodenum. So several different mechanisms for how those things could potentially be life-threatening.
Doctor, did we cover all the internal injuries that you documented in performing the internal autopsy for Alexavier Pedrin?
I believe we did, yes.
Okay. One of the other portions of the autopsy that you mentioned was toxicology and histology examination.
Correct.
Let's talk about toxicology examination. What were the results of toxicology for Alexavier?
So on his tox, I believe there were only two things that we detected. There was melatonin and alprazolam, which is commonly known as Xanax.
Was there caffeine detected or no?
I have to go back and look. I don't recall, but it could be. Give me one moment here.
Sure.
See, there was a presumptive positive on our screen for caffeine. I don't remember if that was verified or not. So I can't tell you for sure.
There was a presumptive positive, meaning that a screen test positive for that, but there was no confirmation.
There was no confirmation, correct.
Okay. And caffeine's not a lethal or dangerous substance?
In most instances, no.
Okay. I want to talk about the Xanax levels that were detected in Alexavier. What were those levels?
So the levels were 250 nanograms per milliliter, although I say that with caution for both of these drugs because we're testing basically the blood that we collected within the abdominal cavity, so that free blood we described earlier. It's very difficult to get good blood samples in children to begin with post-mortem, and so oftentimes our sample size is pretty small, and this was the best we could get. The reason I mention all this is because cavity blood is not the best sample to use to accurately assess the levels of a drug. It's much better just to assess plus or minus. So is it there or is it not there? That level of Xanax is high, in the high range, but again, I can't tell you with much certainty what that translates to in this case.
What type of drug is Xanax or alprazolam?
It's an anti-anxiety medication.
What does it do to our system when we ingest?
So it's a benzodiazepine. It has sort of the typical things we see in a lot of these, which is it sort of has a sedative effect to some degree. In higher quantities, it can decrease your respiratory drive potentially to the point of, many people do overdose on Xanax, and it's usually just from respiratory depression, so they just stop breathing.
If a person has ingested Xanax, can you give us an idea of when you would expect to see them starting to show symptoms from that ingestion?
It's very hard to say. You would kind of have to know how much they took and hopefully when they took it. If you got both of those, you might be able to say something. But I wouldn't be able to say with much certainty. I think I'd leave that to a toxicologist maybe to opine on that.
Can you safely opine that it did happen within 14 hours of death?
I would say if he had received it within 14 hours, then it's entirely possible, yes.
You'd expect him to show symptoms, correct?
Correct.
When you take into conjunction the toxicology results in this case, the internal injuries that you documented and told the jury about, and the external injuries that you have talked about in open court today, what was the ultimate ruling on cause of death in this particular case?
Sure. So the cause of death listed on the death certificate is blunt force trauma, and then contributory factors, the toxic effects of alprazolam. These have to be sort of wordsmithed a certain way to fit onto our death certificate. So stylistically, I don't like to combine them both on one line because the blunt force trauma and the alprazolam are very, very different in terms of their mechanisms. So I put the blunt force trauma in part one, and then the contributory factor being the toxic effects of alprazolam.
Is it important for you to consider those two things in conjunction with one another as well?
They must be, and especially in this case.
Can you explain that to the jury, why they must be, and especially in this case?
Well, just because there are certain things you're going to find on autopsy that have nothing to do with the cause of death. So, for instance, if someone has a massive heart attack and they happen to have marijuana in their system, you don't automatically throw the marijuana in just because it's there. But in a case like this, where you have two things that in conjunction, both or either could be contributing to the cause of death, it's best to put them together to some degree. So for instance, in this case, we have blunt force trauma and all the things we've already talked about that contribute to the cause of death, including potentially multiple impacts to the head, which could make the brain swell, and that could cause death. We've got blood loss, which could potentially cause death. We've got the pancreatic and duodenal injuries, which potentially could lead to organ failure. So lots of things there. But then at the same time, we can't ignore the fact that there's alprazolam in this child's system that can also drive down respiratory rate and cause respiratory depression, which then also could cause the brain to swell if he's not breathing properly.
When you're considering all these things in conjunction with one another, are you also considering whether or not the Xanax that you discovered in Alexavier's system was administered to Alexavier versus him ingesting it on his own?
So there's no way for me to look at a case like this and be able to say with any confidence, was this person given this medication or did they take the medication? However, what we can look at least, was this person prescribed this medication? And we have no evidence of that.
That Alexavier was not prescribed that medication?
Not by any indication that I have so far.
Can you also look at the age and developmental level of the child in question?
Yes.
In this case, a 6-year-old child?
Correct.
Okay. And we can look at the container that the pills allegedly came from, is that correct?
Yes, you can.
Would you expect in your...
Objection. Speculation.
I didn't even ask the question.
I'm not sure which question
It was
you're
not
objecting.
it's not within the expert opinions that were disclosed.
On the issue of the pill bottle? Or what are you objecting to?
You restate them.
Judge, I actually do think it's in his report.
Well, which opinion are you saying it's in the report that?
Page 10 of 10 is in his report.
Why don't you talk to him for a second, show once you left them see what you're saying? Okay, go ahead. I'll allow you to ask the question.
Thank you. Doctor, do you have your report right in front of you?
Yes, I do.
I'm going to ask you to flip to page 10 of your report.
Okay.
Please.
I'm
Are you there? In this section of the report, do you talk about Alexavier's age and his ability, in your assessment, to open a pill bottle if it's properly sealed?
Yes, I do.
Are you talking about pill bottles that have the child safety locks on them?
Yes, I am.
Okay. And what was your assessment of that?
My assessment, I can read it off of here if you'd like. Let's see. I said, it's unclear if the child was given the medication or took it himself. However, it's unlikely that the decedent could open medicine containers if they were properly sealed.
That was a factor that you took into consideration in making your ultimate findings and conclusions?
Yes.
Dr. Quanton, in your review of this case, you had an investigative report from your office related to the underlying facts and circumstances. Is that correct?
Correct.
Okay. You have not, at least to this date, reviewed any of the law enforcement investigation in this case?
I don't recall if at some point during this last 3 years if I ever reviewed any of that, but I don't have any of those records with me at least.
Okay. And just one more time to be clear, your ruling on cause of death was what?
My ruling on cause of death was blunt force injuries, contributory factor, toxic effects of alprazolam.
And your ruling as to the manner of death for Alexavier J. Pedrin was what?
Homicide.
Thank you, Doctor.
Cross? Okay. Why don't we take about a 10-minute break and we'll be right back. Go ahead, Mr. Bowles, with the cross-examination.
Good afternoon, Dr. Quanton.
Good afternoon.
Doctor, you were kind enough to speak with me on a couple of occasions prior to trial, and so I'm going to do my best to do justice to those conversations, and I trust you'll let me know if I get something not quite right, and I appreciate that.
Yes, sir.
Now, right off the bat, I just want to state for the record that there is no question that this poor child suffered abuse. The question for this jury is when, how, and by whom. And this goes to your role here. As you've stated before to me, your job is not to build a criminal case.
That's correct. Yes.
You're there to determine medical cause and manner of death as objectively as possible.
Correct.
And you don't approach every case assuming it's a homicide, as you've said.
No.
You keep an open mind.
Yes.
In fact, that's especially true in a complex pediatric case like this one, correct?
Yes.
Which is why you waited for the neuropathology report, the toxicology, and the histology before issuing your final opinions in this case, correct?
Correct.
Now, the autopsy itself was performed February 13, 2023, is that correct?
Yes.
But your final autopsy report wasn't signed until May 16 of 2023, is that right?
That is right.
Because this was not a straightforward case, as you've suggested.
No, this is a very complex case.
As you said, and you wanted to make sure that you had all of the evidence you could possibly get before coming to your final conclusions and completing your report.
Yes.
Okay. The death certificate, however, in this case, was certified by the medical examiner on March 6 of 2023. You're aware of that?
Yes.
So the medical examiner, Beth Lubinsky, certified the death certificate more than 2 months before you completed your final autopsy report. Is that right?
Yes, according to the data you just provided.
And that was before you had all of the evidence that you needed, right?
Yes.
Now, at the time the death certificate was signed on March 6th, there was still a lot of complex ancillary testing still going on. Is that right?
Yes.
At that time that Ms. Lubinsky signed the death certificate, you were still waiting on the second round of toxicology results.
Correct.
At the time, Ms. Lubinsky, these additional toxicology results were important to give you the full picture of what was in Alexavier's blood at the time he died, correct?
Correct. I believe the question was still whether or not he did or didn't have melatonin in his system.
And he was found to have melatonin.
Yes, he was.
Now, at the time Ms. Lubinsky certified the death certificate, you were also waiting on the results of your neuropath consultation. Is that right?
That's right.
And a neuropathologist is a doctor who specializes in diagnosing ailments of the central nervous system, including the brain. Is that right?
Yes.
Okay. And Alexavier, he died from a condition affecting the brain, correct?
Certainly one of the conditions he had was hypoxic ischemic encephalopathy, yes.
And the neuropath report provided evidence as to the condition of Alexavier's brain when he died.
Yes.
And when Ms. Lubinsky certified the death certificate, you did not yet have that report.
I don't recall when the final neuropath report was issued, but So I don't know. You might know better than me.
And that was consistent with our conversation, and so if I represent that is what we discussed, it sounds like that is accurate.
Yeah, sounds like.
And so that type of evidence is important in a situation like this, where a child dies due to lack of oxygen in the brain, correct?
Correct.
And you did not personally complete or sign the death certificate?
No, since we provide a consultation, basically, since I'm in another state, I cannot sign the death certificate for your state.
But you consulted with Ms. Lubinsky about her findings?
Yes.
Now, you're based in Minnesota, and you indicate you don't have authority to sign that. But you did receive some important evidence about what substances Alexavier had in his blood prior to Ms. Lubinsky certifying that document. Is that fair?
I'd have to go back and look at when the final toxicology results came out, and I think it would be before the melatonin, but I think we already had the alprazolam.
Right, and if the death certificate mentions as a contributing factor the toxic effects of alprazolam, that would suggest that you conveyed that information to Ms. Lubinsky before
Correct.
she signed the death certificate.
Yes.
Now, at the time Ms. Lubinsky signed the death certificate, you had received some important evidence about the substances Alexavier had in his blood, right?
Yes.
Okay. And you had testified on your direct that Alexavier had 250 nanograms per milliliter of alprazolam in his system.
Correct.
Okay. And that level is 2.5 times the amount that would be toxic in adults. Is that right?
Again, yeah, with the caveat of the restrictions we have in assessing that level because of the sample.
Right. And we can get into that just in a minute.
Sure.
Finding a child with 2.5 times the toxic adult dose of alprazolam is not something you would expect to see, is that?
No.
This was a very important finding in your autopsy, correct?
Yes.
And you communicated these results, as I indicated, to Ms. Lubinsky. The highly elevated level of a controlled substance found in the blood of a 6-year-old complicated the picture about cause of death.
Correct.
Did it not? Because we don't know for sure if that level is representative of what he had in his bloodstream. Is that right?
That's right.
But it could represent, we just don't know.
Correct.
And if it were in his bloodstream, that alone could have readily caused death in a child.
In the absence of anything else in this case, it absolutely could be the cause of death.
Okay. And if that were the level, even if the actual amount was half that level, that still could be life-threatening to a child. Is that right?
That's right.
So on March 6, 23, the medical examiner, again, was aware that your finding of a highly elevated level of alprazolam complicated the cause of death determination considerably.
Correct.
Yet on March 6, Ms. Lubinsky certified the death certificate that Alexavier died from homicidal violence or homicidal assault. You're familiar with that language on this death certificate, correct?
I am, yes.
You did not conclude that Alexavier had died from homicidal assault, did you?
No, the only place I put homicide is on the manner.
And you did not conclude that Alexavier had died from homicidal violence, correct?
I concluded that it was blunt force trauma and the toxic effects of alprazolam.
And so you would never have stated to Ms. Lubinsky that it is your belief that he died from homicidal violence, correct?
That's not the phrasing I use, no.
And you don't believe that he necessarily died from homicidal violence, do you?
Not alone. I certainly contributed the blunt force trauma, which then I indicated that I believed it was a homicide by the manner, which sort of speaks to homicidal violence, but I don't phrase it that way.
And homicide, just to be clear, I think this might have been touched on, but that can include, it's homicide, it's death caused by the actions of another or inactions of another, correct?
That is correct.
And so that can include negligent actions, right, or inactions?
Correct.
Now, did any point you authorize Ms. Lubinsky to describe the manner of death as decedent received fatal injuries from homicidal assault?
Well, if I can elaborate a little bit on that.
Sure.
Number one, I can't authorize anything because I have no jurisdiction over that cause of death, or that death certificate. Number two, I don't believe you mean manner. I think you mean how injury occurred on the death certificate.
Yes, thank you for that correction.
Sure.
Correct.
And again, that's a stylistic choice that the certifier makes.
And that is not language you would have used?
Not necessarily, no.
And so Ms. Lubinsky didn't get that from you?
No.
Now, it's your opinion. Now, as we've indicated, the cause of death, it could be from intentional harm or it could be overdose caused by negligence. And it's your opinion that in the overwhelming number of child abuse cases, there is no intent to cause the child's death, correct?
That is my opinion, yes.
And in this case, viewing Alexavier's injuries, one rational interpretation would be that the person who caused Alexavier's injuries did not intend to kill him.
Objection calls for speculation on the mindset of the person who inflicted the injuries.
Asking about a hypothetical, whether that's reasonable.
Overruled.
So may I ask that one more time?
Please.
In this case, viewing Alexavier's injuries, one rational interpretation would be that the person who caused Alexavier's injuries did not intend to kill him. Is that fair?
That is one rational explanation, yes.
Thank you. Now, let's talk a little bit about the mechanism of death. Hypoxia. Hypoxia is the medical term for lack of oxygen, as you've discussed in your direct.
That is correct.
It has multiple causes, right?
Yes.
Now, the brain findings in this case showed hypoxic ischemic injury, and that's lack of oxygen, and it can result from multiple different mechanisms. Is that fair?
Yes.
It can result from blood loss, severe head trauma, other internal bleeding, strangulation, respiratory depression from drug overdose. Are those all different things that could cause that?
Yes, they are.
Now, you noted in your direct that there were no epidural, subdural, or subarachnoid hemorrhages in this case, correct?
Correct.
Now, those are forms of bleeding inside the skull.
Correct. So those are different areas of hemorrhage between the skull and the brain itself. So just epidural is above the dura, which is a membrane over the brain. Subdural is below that. So it's just different layers of bleeding above the brain but below the skull.
And we often see those types of injuries in significant head trauma cases, right?
Correct.
We didn't see that here.
No.
No skull fracture either, as you've testified, correct?
Correct. Yes.
There were some signs of impact, such as bruising,
Yes.
but not the types of injuries you would typically associate with a very strong impact, right?
I can't speak to the strength of the impact other than to say that there were no underlying fractures related to it, but that's not my place to speak to the level of force.
Well, you explained that even without those findings, the brain can still move enough to cause swelling, right?
That is correct.
And swelling is what becomes dangerous because the skull, it's in an enclosed space and it has nowhere to go.
That is correct, yes.
And when swelling becomes severe, it can lead to things like herniation.
Yes.
Herniation is something you look for in an autopsy.
Yes.
And in this case, you did not find evidence of herniation.
There was just global swelling of the brain, but herniation basically is when the brain is running out of space in the skull, so the only place it can go is downward through what we call the base of the brain, base of the skull, or the foramen magnum. And I did not see any evidence of that. There was just global swelling of the brain.
Understood. And herniation is one of the clearest signs that swelling became severe enough to be life-threatening. Is that right?
It is one of the signs.
And doctor, based on the head trauma findings alone, there isn't a clear, obvious structural injury such as bleeding or fracture or herniation that directly explains the hypoxic ischemic injury. Is that correct?
That is correct.
Now, let me move on. So you've indicated those types of severe injuries were not present.
If you mean severe injuries, meaning epidural, subdural, subarachnoid hemorrhage, or skull fracture, then that is correct. They were not present.
And herniation as well.
Yes.
And now, moving on, you were asked about concussion. You recall those questions?
Yes.
Okay. It is possible that Alexavier had a concussion, right?
It's possible.
That requires microscopic analysis by a neuropathologist, right?
Correct.
And the neuropathologist in this case did that exam, right? Or
Yes.
the analysis. And he found scattered axonal swellings and beta-ap immunostaining consistent with diffuse axonal injury. You remember that?
Yes.
That could be evidence of a concussion or traumatic brain injury.
It would be from traumatic brain injury. So again, going back to what we were saying earlier, a concussion in and of itself, you might have some axonal swellings, but over time they heal. Whereas diffuse axonal injury, meaning tears of the axons, they don't recover. So kind of hard to say, but clearly there is an injury histologically to the axons, which are the filaments of the neurons.
That can also be caused by hypoxia, is that fair?
That's fair, but it's a little bit different. Histologically, and again, the neuropathologist would be a better person to speak to this, but histologically there are patterns that better represent hypoxic ischemic change versus traumatic shearing, but in the end, it's all the same reaction.
But in any case, what was seen could be evidence of a traumatic brain injury.
Yes.
And a traumatic brain injury can lead to loss of consciousness, correct?
Correct, yes.
Can be a very serious warning sign.
Yes.
Can also lead to a TBI, again, we're talking about, can also lead to confusion and feeling foggy. Is that right?
That is correct.
Now, you were asked a couple of questions about strangulation, but I'd like to expand upon that a little bit, and I'll do my best to help have you educate the jury about that process, because you are the expert. And I did bring a diagram that might help us in that endeavor. Doctor, I'm handing you an exhibit that's been marked 240. Can you take a look at that diagram?
Okay.
Does that somewhat look familiar to you? Have you seen similar diagrams in the past?
Yes.
Is that a fair and accurate representation of the structures that you examined in your autopsy?
It is, yes. Sure.
Move to admit 240.
Objection.
Move to publish.
No objection. Okay. Will it be published? Received and published.
So just to be clear, you did not conclude that strangulation occurred in this case.
That's correct.
You did not conclude that suffocation occurred, correct?
Correct.
The possibility of strangulation or suffocation is something that you will obviously look for in cases of hypoxic ischemia, right?
Yes, and those can occur with no findings at all at autopsy. So I see no evidence of any of those. That doesn't mean they did or didn't happen. I just don't see any evidence of it.
Sure. So looking at the diagram, would you be so kind as, and if I can give you this pointer, that might help.
I've still got one here if you want me to use this one.
Thank you. My vision isn't what it, well, ever was, I guess. It wasn't. So, doctor, can you please identify the hyoid bone?
Sure. The hyoid bone is this small bony structure that goes sort of horizontally across the neck here in the midline. It's above the thyroid cartilage, which is what most people would call the Adam's apple. So it's right there.
And how about the thyroid cartilage or the larynx?
So the larynx is what I was just pointing to. Below the hyoid, you have the thyroid cartilage here and then the cricoid cartilage down here.
Okay. And how about the strap muscles?
So that would be all of these muscles that we see here, some of which have been transected and reflected.
And I might butcher this, but the sternocleidomastoid muscles, could you identify that?
Sure. Sternocleidomastoid muscle is the big muscle here. So if you turn your neck to the side, this big muscle that you feel right here is the SCM. And it actually has two heads. It's got the clavicular head and the sternal head, or sternal head here. So it actually bisects down at the bottom here.
Doctor, and in strangulation, where is pressure applied to the neck generally?
Generally, I mean, it could be anywhere in this entire region, but generally it's upper neck close to the angle of the jaw there. So in this line, roughly where the hyoid bone is, or right above or below that.
And pressure applied to the strap muscles, for instance, pressure applied to the neck will affect the strap muscles, is that right?
It could.
Okay. And pressure applied to the hyoid bone that can be damaging to the hyoid bone. Is that correct?
It may or may not, depending on the age of the person.
Okay. And the same questions, I assume, are the same answers for the larynx and for the other soft tissue structures that can be injured.
Correct.
Okay. Now, when force is applied to the neck, you often see hemorrhage or bleeding in those muscles, in the strap muscles. Is that right?
If given enough force, then yes.
And when force is applied to the neck, you often see injury around the hyoid bone. Is that right?
That's right.
When force is applied to the neck, you often see injury to the laryngeal cartilages, correct?
You may, yes.
Those injuries can only be seen by dissecting the neck,
Correct.
which you did in this case.
Yes, I did.
My understanding, you found no hemorrhage of the strap muscles. Is that right?
Yep.
No damage to the sternohyoid and sternothyroid.
Those are the next layer down, but yes.
And you found no trauma to the deeper neck tissue. Is that right?
Yes, that is.
You did perform an anterior neck dissection, meaning you opened and examined all these structures as you testified. And your report states that there was, quote, no evidence of muscular or soft tissue trauma. Is that accurate?
That is accurate, yes.
So nowhere in that area up on that diagram did you find any internal injury?
Correct.
And nowhere in that area did you find any hemorrhage or internal bleeding?
Correct.
And your report notes that the hyoid bone was intact.
Yes.
And we've talked about how you've found no evidence of damage to the hyoid bone.
Yes.
And you also note in your report that the larynx and cartilages were also intact.
That's correct.
So there was no evidence whatsoever of strangulation involving the larynx and the thyroid cartilage.
Correct.
The airway framework itself was not injured.
Not that I can see, no.
So air would have been able to freely flow. There was no damage that would be consistent with strangulation in that regard.
Well, with a caveat. So during a strangulation, one can impinge the airway flow, but that doesn't necessarily show anything at autopsy. So if you're asking me if there's an obstruction during the autopsy, no, there's not.
Right. You also looked for what are called petechiae, right?
Correct.
And those are small hemorrhages in the eyes and face?
Correct.
And petechiae in the eyes and face are strongly correlated with death by strangulation, isn't that right?
They're correlated with increased intracranial pressure. They can be very nonspecific and be seen in lots of things. Now, they are far more likely to be seen in strangulation cases than in other cases like, for instance, hanging or suffocation or anything like that.
At one point, they were considered diagnostic, but that has been changed.
I would not call it diagnostic, no.
But what does that mean?
It's supportive. So basically, to back up to talk about mechanism, the reason you get these petechiae in the eyes or the face, these are just tiny burst blood vessels because of increased blood pressure in the face. How do you get that? Well, you block off some of the blood flow, but not all of the blood flow. So for instance, if during strangulation, while the hands or whatever is around the neck, you're blocking off some, but probably not all blood flow into the head. And so that if you cut off the venous flow out of the head, but blood is still getting into the head because it keeps pumping in there, you're more likely to get petechiae. So that's where you see that. In a hanging, where someone is fully suspended and their entire weight of their body is on their neck, you actually don't ever see, usually, petechiae because the weight is such that it cuts off all circulation, so it's an even exchange. There's no blood going in, there's no blood going out.
And just to reiterate, petechiae in the eyes and face are very often seen in cases of strangulation.
Yes.
And they were not found here.
No.
No petechiae in the facial region, none in the eyes, none in the mouth.
That's correct.
So none of these classic signs of strangulation were present.
Correct.
Let's talk about the external neck injuries. You noted 2 linear abrasions.
Yes.
On one side of the neck, correct?
Correct.
These were small superficial injuries?
Yes.
No deep injury underneath them?
No.
No corresponding internal damage?
Correct.
And we are looking at suffocation or smothering as a potential manner of death, you were looking for signs of how that could happen, right?
Correct.
You're looking for things like a sign of struggle, right?
Depending on how you mean struggle.
Well, when somebody is assaulted in that manner, sometimes they will try to react or respond, and sometimes you'll see defensive injuries consistent with that.
Sure. And just for clarification, are we moving on from strangulation to suffocation and smothering, or are you
Yes.
encompassing them all together?
No, we're on suffocation
Okay,
and
just
smothering.
making sure.
Thank you. And you examined Alexavier's mouth and nose area, right?
Yes,
And if Alexavier had been smothered, you might expect to see damage inside the mouth. Is that right?
if there was a struggle, then potentially yes.
But you found no damage inside the mouth. Is that correct?
That's correct.
Now, if Alexavier had been smothered, you might expect to see injuries to the tongue.
Again, very variable. If there's a struggle and he bites down on his tongue, potentially.
But you found no damage to the tongue.
Correct.
And if Alexavier had been smothered, you might expect to see injuries to the lips. Is that fair?
Yes,
And you found no damage to the lips.
that's correct.
If Alexavier had been smothered, you might also expect to see injuries to the gums.
Potentially yes.
You found no damage to the gums.
Correct.
In fact, you found no injuries to Alexavier's mouth or nose that one might expect to see in a case involving suffocation. Is that fair?
That's fair.
There's also no evidence that Alexavier was kicked in the mouth. Is that right?
None that I saw, no.
Now, you noted gastric contents in the airway, correct?
Correct.
That can occur in vomiting, correct?
Yes.
That can occur in resuscitation, correct?
Correct.
That can occur in the dying process, correct?
Yes.
It would be fair to say that your autopsy findings do not support or indicate strangulation as a cause of death, fair?
That is fair.
It would be fair to say that your autopsy findings do not support or indicate suffocation as a cause of death, fair?
That's fair.
And if you thought strangulation or suffocation were likely or even plausible causes of death, you would have put that in your autopsy report, correct?
If I thought it was likely, yes. If I thought it was a plausible explanation, there's not really a reason to put it in the autopsy report because it's not a finding.
Understood. So now, you were asked just some questions about malnourishment and dehydration. Do you recall those questions?
Yes.
Would it be an important data point to understand that Alexavier was hospitalized a month prior and was evaluated for those conditions?
Yes.
And during that evaluation, the doctors ran a full blood panel and found no significant concerns about dehydration or malnourishment.
Judge, I'm going to object. This is hearsay unless those doctors reviewed those records.
I don't know if he's reviewed these.
I mean, this has to do with whether or not that would be an explanation. So it's not offered for its truth at this time, but it's a question of whether that would impact the assessment of whether the malnourishing or dehydration came after that visit.
Okay, you can pose it as a hypothetical then.
Okay. So hypothetically speaking, if Alexavier had been examined and a full panel run on him, and there were no concerns about dehydration or malnourishment, would that suggest that those conditions, to the extent they were reflected in the examination you provided, would have occurred subsequent to that hospitalization?
That's correct, yes.
And if, for example, hypothetically, if a child were vomiting chronically and had chronic diarrhea, those conditions could affect both, well, the diarrhea and the vomiting can also affect dehydration, correct?
Oh, absolutely, yes.
And also malnourishment as well.
Yes.
Okay, so let's move on to the topic of blood loss. Blood loss is an issue in this case, right?
Correct.
There was some internal bleeding, as you mentioned, 100 milliliters of internal bleeding that you measured.
That's right.
And I think you had described it as not a ton of blood. Is that a fair
Yeah,
characterization?
I mean, it's a substantial amount, but it's not, by in and of itself, much like everything else in this case, in and of itself, that one finding is not necessarily life-threatening.
And would you agree that according to scientific studies, blood loss does not become life-threatening until it approaches 33% or 1/3 of total blood volume?
That's roughly what's in the literature, but again, that's sort of a static statement and doesn't take into account anything else about the case, but sure.
Sure. So 33% is the minimum threshold for exsanguination or blood loss to cause death that you look for in a patient or an autopsy.
I don't necessarily measure it out to a percentage. And in a case like this, the other issue is that we have free blood that we try to measure what we can capture, what we don't lose during the autopsy, but also there's the inability to measure the additional blood that we see that's in the tissues. So related to a lot of the trauma that this child has, there's other hemorrhage within some of the soft tissues around the duodenum and the pancreas and things like that, that we can't necessarily tabulate, like what the volume of blood loss that is. So in general, I don't use a number to say this case has lost X percentage and thus they have died from exsanguination.
Sure. And those other areas of unmeasured blood, organs and things like that, they could, they certainly weren't measured, but the organs have structures within them that don't make them just like absorb, a lot of fluid. Some of them could have just a little bit, but there's just no way to know.
There's no way to know.
Okay. So for a child Alexavier's age, help me if you have a different understanding, but my understanding is that he was 21.5 kilograms at the time of his death.
I would have to quickly look, but I believe that is correct, yes.
Okay. And based on my understanding, I did an estimation of what the total blood volume would be associated with a child of his age, and the range I found was 1,500 milliliters to approximately 1,600 milliliters. Does that sound fair to you?
I'll have to take your word for it because I didn't do the calculation.
Well, so it's 70 to 75 milliliters per kilogram is the ratio or the calculation. Is that fair?
I believe I haven't done those calculations in a while.
Does that sound roughly accurate, or that doesn't sound too out of?
It doesn't sound way out of reach, no.
Okay. So this would put the total blood volume vicinity of 1,500 to 1,600 milliliters. And 33% of that total blood volume on the low end would be 500 milliliters. Is that fair?
Sounds like your math is correct.
Not always the case. Thank you. So again, you collected 100 milliliters of blood from the abdominal cavity. And that amount standing alone is 1/15 of Alexavier's total blood volume using the conservative estimate. Is that fair?
That's fair.
So in order to meet the minimum threshold, and I understand that there are other factors, and we could certainly get into that, but talking about blood loss standing alone, in order to meet the minimum threshold for life-threatening blood loss, it would have to be 5 times the amount you measured.
According to your calculations, yes.
And so even if we could quadruple that amount, you would still be below that threshold for onset of shock, which is my understanding, that 33% level.
Correct.
So let's talk a little bit more about the possibility of a drug overdose in this case. Now, if Alexavier's death occurred quickly, such as in the case of strangulation, you would not expect to see the significant hypoxic ischemia that you found. Is that right?
Let me make sure I'm understanding your question, but you're saying if he was strangled, would I see that level of brain swelling?
Right.
You probably still see a pretty good amount of brain swelling. Again, it's the normal sort of reaction to hypoxia. So you would definitely still see some. Now, I can't look at it and say you'd see less in strangulation or more in this or what have you. So,
what you're describing, though, in general, the injuries that you observed, you believe that the death was a gradual process?
Sounds like it, yes.
Okay. In a gradual process, that would be perfectly consistent with an overdose, right?
Could be.
In our previous discussions, you indicated that Alexavier's presentation fits very well with a drug overdose. Do you recall?
It certainly does.
And as we've noted, a highly elevated amount of the drug alprazolam was found in Alexavier's system. It can suppress breathing, right?
Correct.
And the level detected here, 250 nanograms per milliliter, again, was 2.5 times the level considered potentially toxic in adults.
That's correct.
And if that level accurately reflected circulating blood, it could be lethal.
It could be.
And it is possible that that highly elevated level was, in fact, what Alexavier had in his bloodstream before he died. Fair?
It's possible.
In fact, anything over 100 could be a lethal level for an adult, right?
Correct.
Now, as you've indicated, interpretation is limited because the sample was cavity blood, not femoral blood.
That's correct.
So you can't determine with certainty how much alprazolam was actually ingested just using that cavity blood alone, correct?
That's correct.
But we do know that it is possible that it represented the level in his bloodstream.
It's certainly possible that it represents one of many possibilities, but yes.
Yes. And children, fair to say, they're not just little adults.
That is correct.
And we don't have any data on Xanax toxicity in children because of obvious ethical issues. You wouldn't want to do experiments such as that. But we're left with what's toxic for adults as a means of comparison to children, correct?
Correct.
And presumably the toxic level for a child would be even lower than what would be a toxic level for an adult.
Presumably, yes.
So it would not be unreasonable to conclude that the level of alprazolam that is toxic to a child is even less than 100 nanograms per milliliter. Fair?
It's not unreasonable.
And would it be fair to say that you cannot rule out that alprazolam alone caused the fatal respiratory depression?
That is not unreasonable either.
Now, Dr. Quinn, investigators found what they believed could have been pill fragments on a pillow where Alexavier was resting. Were you aware of that?
It's been a while since I read anything, so I'm not sure if I was aware of that at one time or not.
That certainly would have been relevant to the analysis as to the sequence of events and whether this was an accidental overdose. Is that fair?
It would be relevant to the circumstances. In the end, really, it's what's in the system that's most important, but it would be relevant to the circumstances.
You would agree it would be helpful to know what those fragments were?
Sure, yes.
Now, as you've testified, alprazolam can have a sedative effect.
Correct.
And a 6-year-old would be capable of getting into medications by himself, correct?
You're asking, would he be capable?
Yes.
Possible, yes.
And there was questions regarding the safety features of pill bottles being intended to prevent children from getting into it, and that a 6-year-old child may not have the motor skills or capacity to do that. Is that a fair characterization of your testimony?
That is a fair characterization, yeah.
You're aware, however, that those have opposite sides that are just threaded, and you can just screw those in, and there's no safety feature involved in that particular configuration when you screw it on upside down.
Well, again, it's one of those where the point I was trying to make is if they were secured properly, to prevent a child from getting into it.
Correct. Yeah. You don't want to leave those around children, certainly. So a 6-year-old is not necessarily old enough to contemplate the consequences of taking too many medications, right?
I'm not a child psychiatrist, but I would agree, having had my own children, that they're not aware of many consequences at 6 years old.
And so a 6-year-old, he might pick something up off the ground and put it in his mouth. Fair?
Less likely than a 1-year-old, but potentially.
And if there were, correct that, that certainly could have happened here, right?
It may have.
Now, you testified at your prelim that Alexavier could have ingested alprazolam prior to 6 p.m. the day before his death, prior to his death.
If you're asking if I said that and it's in the record, I'm going to say yes. It's been a while since that.
Thank you. And you are aware that Sergeant Kernine with the La Crosse County Sheriff's Office came through the house around 7 p.m. for a welfare check the night Alexavier passed away.
Yes,
And at that time, Alexavier was resting on a couch.
that's my understanding, yes.
And if there was testimony that Sergeant Kernine shined a high-capacity police flashlight onto Alexavier's face, but was unable to fully awake or wake Alexavier, would that be consistent with Alexavier having ingested alprazolam prior to 6 p.m. that night before?
Yes,
And you would agree that it would be possible that Alexavier later awoke and was moving around and getting into things. He could have ingested more alprazolam, and that would have been the fatal dose later that evening.
so either possibility is true or potentially true.
And you testified that a concussion can lead to a loss of consciousness, correct?
Correct.
And are you able to rule out the possibility that when Sergeant Kernine observed Alexavier in a deep sleep that he may, or difficult to wake, that he may have lost consciousness after suffering a concussion?
Are you asking losing consciousness before or after he was witnessed by the sergeant?
I'm asking if you can rule out the possibility of when Sergeant Kernine observed Alexavier in that state, that Alexavier may have lost consciousness after suffering a concussion.
The only thing I can say is that what he observed sounded like the child was lethargic. I can't explain what from. Could have been drugs, it could have been concussion, could have been both of those combined.
That would be consistent. You can't rule out that possibility that Alexavier had lost consciousness due to a concussion or TBI, right?
Right. Like many things in this case, there's a lot of things are a possibility.
And if there is evidence that Alexavier was conscious and acting kind of loopy after he initially was laid up on the couch, could that be consistent with Alexavier having suffered a concussion earlier that evening as well?
It could be, yes.
Now, forensic pathology cannot identify who caused an injury, correct?
That's correct.
And you testified previously that you cannot date injuries to a specific hour.
Correct.
And when you say an injury is recent, that could mean hours or even a day or two.
That's correct.
And you cannot determine what specifically caused Alexavier's injuries.
That's correct.
Some of the abdominal injuries could have been caused by a child stepping on or jumping on the abdominal cavity from an elevated position, right?
It could be, yes.
Doctor, this has already been published, so I'm going to put this on the Elmo, if that's okay.
Okay, can you say what exhibit it is?
This is, I've been handed Exhibit 51.
Okay.
And I'm looking at the pattern into the upper half of that photograph. And you recognize that from your autopsy, doctor?
Yes, I do.
And you mentioned how sometimes you can tell how an injury might have occurred by looking at patterns. Is that right?
Correct.
Would it be accurate to say that that may be the pattern of a foot?
I would not be able to make that assessment from that. This is a constellation of overlapping bruises. That's as far as I would go on this one.
It certainly could be.
It could be caused by many things. Anything that could cause a blunt force trauma, foot would be included.
Thank you. Now, as you've testified, Dr. Quanton, you cannot determine exactly when these injuries happen. What you can say is that the significant injuries you found must have happened within the last 24 hours of Alexavier's life.
Correct.
And that uncertainty applies to the liver injury, to the pancreatic hemorrhage, and the rib fracture in this case.
Correct.
You would agree that bruising is very difficult to date, as you've testified.
Yes.
And no doctor can accurately date the time frame as to when a bruise might appear.
That's correct.
Bruises can take time to develop.
They can take time, and also it depends on the decedent's skin tone and their ability to clot and many, many other factors.
And just because someone doesn't have a visible injury doesn't mean they will, just because someone has an injury, doesn't mean they will show bruising right away, correct?
That's correct, and we even saw this on this case. So as we did the dissections, there's, in the report, underlying bruising that is observed that doesn't necessarily correlate directly with something we see externally.
And in fact, bruising can appear for the first time even after death.
In some cases, yes.
And you have previously testified that if Alexavier had been injured the night before, around between 5:30 and 7:30 when Derek Pedrin was at the home, those bruises may not have appeared until hours after the fact, correct?
That's correct.
Now, nobody can rule out that these injuries occurred between 5 and 7:30 p.m. the evening of February 10, 2023, fair?
Not that I'm aware of, no.
And you are aware that, well, strike that. You were asked some questions about cerebral edema. Do you remember that?
Yes.
It would be fair to say that cerebral edema observed could be a result of trauma or from the toxic effects of alprazolam.
Correct. Yes.
Now, you observed some bruising around Alexavier's elbow. Is that right?
That's correct.
You would agree that those appear to be consistent with Alexavier being forcefully grabbed or dragged by the arm?
They could be consistent with that, yes.
Were you aware that Mr. Pedrin has frequently been accused of doing that to both the children and Ms. Dikeman?
No.
And nobody can rule out Derek Pedrin forcefully grabbing Alexavier by the arm as the mechanism of that injury?
Correct.
Now, you don't decide who gets charged in the criminal case, fair?
I do not. That is correct.
You rely on law enforcement to provide a complete and accurate history.
Yes.
Right? And if investigators reach conclusions early, that can limit the information available to you, correct?
Correct.
And your medical opinions can only be as complete as the information you receive.
That is correct.
And so we understand medicine cannot answer every question with certainty, right?
Yes.
You cannot say who caused Alexavier's injuries.
Correct.
You cannot say precisely when those injuries occurred.
That's correct.
You cannot say that the person who caused these injuries intended to kill Alexavier, correct?
That is correct.
And from a medical standpoint, no forensic pathologist can rule out accidental overdose as the cause and manner of death, correct?
From a medical standpoint, I might have to repeat that question.
Well, I would just say you cannot rule out accidental overdose as the cause and manner of death in this case.
If I couldn't comfortably rule it out, I would have called this case undetermined. I felt confident enough between the alprazolam and the blunt force trauma in combination to call this a homicide. So if I thought there was a possibility that the sole cause of death in this case was just an accidental overdose, which we'd then have to define what we mean by accident, how did he get the alprazolam, how much was he given, then I may have backed down and called it undetermined if I was not sure.
Sure, but I believe you testified that the conditions you found, either standing alone or in combination, could, standing alone, have caused death, right?
The condition of the alprazolam in his system? Or?
No, the injuries, so you notice the internal injuries, the blunt force trauma, and then the alprazolam. Now, either of those standing alone could have caused death.
Correct.
Thank you, Doctor. I have nothing further.
Thank you.
Redirect.
Doctor, you were asked about a number of hypotheticals. Do you remember those questions?
I don't know that I could read them all back to you off the top of my head, but yes, I was given hypotheticals.
Okay, it's important for the information you receive in a hypothetical to be accurate. Is that correct?
It's important, well, a hypothetical is a hypothetical, so I'm not sure what you mean by accuracy.
If you're relying on the information in a hypothetical to provide an answer based on that information, the information that you provide relying on that hypothetical can only be as accurate as the hypothetical that's been provided.
That's correct. The assumption is that what is provided in the hypothetical is what my decision is based off of.
Okay. One of the things that defense threw out there during the questioning was that there's evidence that Derek Pedrin grabbed Alexavier by the arm in the past. Is that correct?
That was one of the hypotheticals, yes.
Okay. They did not show you a police report or any information that indicated that that happened or when it happened, did they?
No.
Okay. They just asked you that question to assume that actually happened.
They just asked me hypothetically, could that cause the injury, and I said yes.
And grabbing a kid by the arm forcefully can cause that injury.
Correct.
Okay. Now, they conceded in their questioning that Alexavier Pedrin was an abused child. At the very beginning, they said there's no doubt that he's abused. Do you agree with that?
I do.
Alexavier Pedrin was a child that was abused, and it's important to look at, when we're talking about Alexavier as a child that was abused, to also look at the Xanax in conjunction with that. Isn't that true?
Correct.
Okay. Because it would be difficult for a non-abused child to be given Lazepam or Xanax and go unconscious and then abuse that child afterwards. That'd be kind of weird.
It would be atypical for sure.
Okay. So a safe assumption is that this child was abused and then administered Xanax afterwards.
Yes.
Or if you take what they're saying, was physically abused significantly, and then after being physically abused significantly, got into Xanax on his own.
Correct.
With a broken leg.
Correct.
And limited mobility.
Correct.
Okay. Now, you were also asked about the pill caps at the house and that you can flip them on the other side and close them easy that way, correct?
That's correct.
And if you do that, that does not trigger the child locks on it, does it?
No.
Did they show you any of the pill bottles that were recovered in the house?
No.
Would you be surprised to know that every single pill bottle that was recovered in the house, save for the one that was located on the floor, had the
Hold on a
child...
second, wait, what's the objection?
It's a hypothetical.
Hypothetical, go ahead.
Would you be shocked to know that...
That's not a hypothetical.
Okay.
I'd be shocked to know is argumentative, yeah.
if every single pill bottle that was recovered in the house had the child safety lock engaged on it, save for the one on the floor, will that further affect your opinion as to whether or not these medications were given or administered to Alexavier?
I would not rely on that for my opinion.
Okay. What about the tasting of the medication itself? Medications are made to taste bad, is that right?
That's correct.
Okay. And that's something that would impact, does that impact your assessment of whether or not Alexavier ingested the medication?
Again, it's kind of like talking about getting into the pill bottles. It seems unlikely that a child would eat multiple pills, but at the same time, I can't speak to whether or not he may or may not have. At this point, we're looking at, is the medication in his system, yes or no?
Okay. Were you also told or were you made aware that there was a bag of medication that the defendant claimed was moved by Alexavier that evening?
I don't remember if I had that information or not.
Okay. And were you aware that all the pill bottles in that bag of medication were all properly secured? Were you informed of that?
I don't know.
Were you informed that the pill bottle that was located open and empty on the floor was for a medication other than Xanax?
I believe they said prednisone originally is what they thought he had overdosed on.
And that was the information that you received at the time that you got the body?
That was from the initial report I had.
Okay. Were you informed that there were 10 pills of prednisone located open in the purse?
Objection.
I'm asking if he was informed of it.
Overruled.
Again, given that it was 3 years ago, I don't recall if I was or wasn't.
Okay. And I want to talk about some of the other things that the defense discussed with you. They brought up epidural hemorrhages, subdural hemorrhages, and subarachnoid hemorrhaging. Is that correct?
Correct.
That's all bleeding that can take place on the brain, is that fair?
Over the surface of the brain, yes.
And when you see that bleeding over the surface of the brain, you typically see that more in cases of rotational forces imparted on the head, is that fair?
For some of those hemorrhages, the rotational forces are more likely or less likely, but any one of those bleeds can be caused from a rotational injury or just a flat-out, single blunt impact to the side of the head. So it's variable.
The fact that you didn't see any of those forms of bleeding on the brain does not mean that he didn't suffer multiple blunt force impacts to the head. Is that fair?
That is fair.
Wait. Hold on a second. What was the objection? The leading question. Okay, go ahead.
Okay. Alexavier had brain swelling.
Yes.
Brain swelling is a severe injury to the brain?
Yes.
You don't need herniation of the brain for the brain swelling to be severe. Is that correct?
Correct.
So the mere fact that herniation is not present does not say that the swelling that Alexavier had was not severe in this case.
Correct.
You can also strangle a child as a form of child abuse, correct?
Yes.
And you can strangle a child without having injuries to any of the neck muscles
Yes.
or the hyoid bone?
Yes.
Okay. The fact that none of those injuries were present in this particular case doesn't mean that he wasn't strangled or choked or anything of that nature, correct?
That's correct.
It's that you didn't see those physical medical signs on autopsy.
Correct.
You were asked about medical records from a medical visit about a month previous. You weren't shown those in court today, were you?
Not today, no.
Again, there was a hypothetical and you were asked to presume things about those medical records.
Yes.
There was a great deal made about the amount of Xanax or Azalam that was found in Alexavier's system, correct?
Yes.
When it's that high of an amount, you would expect him to show symptoms faster, right? When you have a higher amount of a substance in your system, you'd expect to show symptoms faster than you would if it's a lower amount.
I think that's a fair assessment, yes.
Okay, and this is what the defense said would be toxic for an adult.
Correct.
And this is a 6-year-old child.
Yes.
That's all I have, thanks.
Any redirect? Or recross, excuse me?
Doctor, to be clear, to clear up your earlier testimony, the physical injuries alone could have been lethal if they continued to bleed, correct?
Correct.
And you did not state that that was inevitable, correct?
Correct.
And your opinion necessarily relies on the presence of Xanax for cause of death, correct?
Yes, it's both of them in combination.
And just to make clear, the amount of Xanax alone could cause death, correct?
That is correct.
Thank you.
Any redirect?
The amount of Xanax in a physically abused child could certainly cause death, correct?
Correct.
Yeah, thanks.
Okay, anything further? Okay. All right, may I step down? Why don't you give me the